first coronavirus case in Wisconsin, and it's confirmed right here in Madison.
Dane County public health officials confirmed just 30 minutes ago the patient lives in Dane County. They are being tested and evaluated at UW Hospital in Madison and currently in self-quarantine at home, reportedly doing well. The Wisconsin Department of Health Services isn't releasing the patient's name, but did offer that they traveled to Beijing, China, and were exposed to known cases of coronavirus.
Right now, health officials are monitoring people who came into contact with this patient. Officials want to stress the risk of coronavirus spreading remains low, and they're doing everything they can to contain it.
The Wisconsin case makes 12 confirmed cases in the U.S. The first confirmed case was in Washington state. Since then, the CDC has confirmed 6 in California, 2 in Illinois, 1 in Arizona, and another in Massachusetts. We are bringing you team coverage of this breaking story tonight. AJ Bayapur is standing by with what health officials are telling people to do at home.
But let's begin with Michelle Alfini. She's at UW Hospital where this case was confirmed. Michelle?
George, Amber, we heard from the medical director of the infection control here at UW Health just a little bit ago. And now, as you said, that patient is not currently at the hospital, but recovering at home. Although UW Health does tell us that they have taken specific steps to ensure the virus will not spread. According to UW Health, this patient came to them expressing concern after experiencing cold symptoms. The patient recently visited Beijing, and when doctors heard that, they took the patient in for testing. She says they all wore protective clothing, and UW is ensuring every employee who came in contact with this patient will be tested as well. As for the general public, she says catching the virus is unlikely, but there are a few symptoms to look out for.
I think for the general public, it's influenza season, it's cough and cold season, so they should look out for the usual symptoms of a viral respiratory illness.
At this point, UW Health says they still have tests out to the state hygiene lab pending results, and they can't say whether or not they expect any more positives. As for this specific case, that patient is recovering at home in self-quarantine, and UW Health says they did not need to be hospitalized because their symptoms were not very severe, and they are expected to make a full recovery. In Madison, Michelle Alfini, 27 News.
Health officials are stressing this news might seem alarming, but the health risk to the public is very low.
AJ Bayapur has you covered on what you need to know tonight. AJ?
Amber, George, the State Department of Health Services says the best preventative action you can take to guard against this strain, called by doctors as the 2019 novel coronavirus, it's basic hygiene, stuff you've already heard before. Cover your mouth when coughing and sneezing, wash your hands thoroughly, and stay home when you're sick. A novel coronavirus is a new strain, one that has not been previously identified. Symptoms of the coronavirus, similar to the flu, include cough, fever, difficulty breathing. How badly the virus has affected patients has ranged from something like a common cold all the way to severe pneumonia. To date, nearly 25,000 people have been infected worldwide, with nearly 500 deaths reported, the vast majority of which are in China. Again, state health officials here in Wisconsin emphasize the risk to the general public is very low, but they're still taking this very seriously.
At this time, the risk of getting sick from 2019 novel coronavirus in Wisconsin is very low. We're responding aggressively to the situation and monitoring all developments.
State DHS officials say they've investigated 10 possible cases of the novel coronavirus in Wisconsin so far. 7 of the results have already come back negative. Officials confirm this positive result comes from one of the cases that were still pending. They expect the results for the other 2 cases to come back in the next day or two.